My name is Disa Van Arhoven, and I'm the Executive Director of the Marian Institute. The Marian Institute is dedicated to identifying and promoting programs around the world that create deep and positive change. We work with individuals, with schools, with communities to inspire change in the areas of health and healing, green economics, sustainability, environmental education, spirituality, and more. Paracelsus Biological Medicine Network, or PBMN, is one of the 7 programs of the Marian Institute. This program recognizes the distinct need of holistic medicine in today's toxic world. PBMN is dedicated to healing through biological medicine and making this more available and accessible to people in North America. Paracelsus Biological Medicine helps people work with their body's natural healing power to fight diseases such as Lyme disease. The primary goal of biological medicine is to empower the human organism to heal itself. Since you're here, you probably know we live in a Lyme disease epidemic high-risk area. For every 100,000 people, 2,988 cases of Lyme disease were reported in Massachusetts in 2007. It can be difficult to know how to address this disease because doctors have differing opinions about how to diagnose and how to treat. It has more than likely impacted all of our lives and will continue to do so. A recent article put out by the Paracelsus Clinic states that the antibiotic treatment of Lyme disease is counterproductive, except for perhaps during the first 2 weeks of stage 1 Lyme disease. Antibiotics are used to treat most Lyme disease patients here in the US, which is just one topic that Dr. Rao will discuss tonight. In addition, studies have found that there is a correlation between the environmental toxic load of an area and the incidence of Lyme disease. The underlying premise of the Marian Institute is to address an issue starting from its root and to provide a solution. We believe that biological medicine addresses the problem at its root and heals the body from the inside out. The stresses of modern society, our increasingly toxic environment, and lack of appropriate nutrition all contribute to our current health crisis. We feel biological medicine addresses them systematically and individually. I would like to thank Dr. Thomas Rao for being here to share with us tonight. He is so dedicated that not even volcanic ash. As one of the world's leading doctors of biological medicine, founder of Paracelsus Biological Medicine, author of The Swiss Secret to Optimal Health, excellent John Wayne impersonator, really, and the chief medical director of Paracelsus Clinic in Switzerland. We could not ask for anyone better to teach us. I would like to take a second to thank the board of directors of the Marian Institute, especially co-founders Michael and Marty Baldwin. My Marian Institute teammates, all-star volunteer Lucas Ribeiro, who was instrumental in organizing tonight's event as well as the seminars that we will hold for the next 3 days. And last but not least, the Marian Institute's director of PBMN, Barbara Christian, who works tirelessly to improve the health of the people in North America. Without further ado, I would like to welcome our guest of honor, Dr. Thomas Rao.
Now she went. Good evening. Many thanks that you came so numerous. It's really an honor to me to speak here. It's the second time that I have the opportunity to speak here. And I would like to thank very, very deeply to Maggie and Michael Baldwin, who were the founder of this idea, the founder of the Marian Institute, and which enabled me to come here to the United States and to do all these many seminars and speeches which I did during the last years. Many, many thanks to Barbara, who organizes. Many thanks Barbara Christian, who organizes the whole thing, who organizes all my seminars, and many thanks to Disa, who did this introductory speech here, and I must say, probably she would have done very well, even if I couldn't have come. She would have done the speech probably herself. Now, Lyme's disease is a disease which increases very fast in number. Do you hear me? Is it loud enough, or do I have to shout? Huh?
A little louder.
A little louder, okay. Okay, yeah. Well, Lyme's disease is one of the fastest growing in number infectious disease in the Western world. It's especially here, it's very frequent, but also in the whole Western world. And it's very interesting that in the Eastern world, this disease is not as much spread. It also exists, even though there are also ticks and also deer and also forest and also workers in the forest. But why isn't it so frequent there, and why is it so frequent here? Is it really the Borrelia, the bacteria, or is it something else? And this was the background of my studies, of our work, and also the background idea behind what I speak tonight. Now, very shortly, because I don't have time, well, I have my Swiss watch here so that I really follow exactly what I was told, and not too long, because normally I speak too long. And, and so, very shortly, I go through some slides. You know, why do I come here from Europe, from Switzerland, beautiful Switzerland, to speak here about Lyme's disease? This has a background, not only that I'm invited, but also that I treat, or we treat in our clinic in Switzerland, we treat many American patients. Not only Lyme's disease patients, of course, but also other chronic diseased patients, mainly cancer patients, autoimmune patients, and just individuals with difficult diseases. And why do they come so far to us? And couldn't they do it here? Well, perhaps they could do some of the treatments. Unfortunately, not all the treatments which we do are allowed in the United States. That's why people come so far. And it's also that we combine all the different natural medicine techniques, and this is probably the most important difference between what is done here in the United States and what we do. Our clinic is quite a big institution. It exists since 52 years. It has a medical department, it has a dental department, it has a restaurant, and we also have a hotel which belongs to us, and where the patients get their correct food, because food, as you will see, is something very important in the treatment of chronic patients. Not only Lyme's, of course, and not only cancer, but also of all chronic patients, because the food is what determines our body. Now, this is the beautiful area where our clinic is situated, a pharmacy, and so on. It's the biggest clinic for biological medicine in the German-speaking world and in Middle Europe, and it exists quite since 52 years now. 10 doctors, 4 dentists, a staff of around 100, and I had the opportunity to take over the medical lead 18 years ago. Now, we don't have much time to talk about the clinic. I would like to talk about Lyme's. Now, I asked myself, why does the treatment in so many cases not work? And why do patients, when they get treated, even get worse? Why do we have this increase in phase 2, phase 3 Lyme's disease, even though everybody knows it's caused by spirochetes, it's caused by a bacterium which is treatable very easily with antibiotics. And still, it's not working. So is it really the germ, as we think in our mechanistic thinking, or is there something else? And this was the background of our researches and just of our follow-up, what we did on all our patients, because most patients who came to us with their severe disease of Lyme's, you will see the symptoms afterwards. We have here some of the people who sit in here. I know they have partially severe Lyme's disease and they have been treated with antibiotics and still they are not well. So we have to think about behind what is it really. Our treatment does not address the germ, it addresses the human being in its whole. And this is the important thing. It addresses the inner milieu and not the germ. Because the milieu determines the pathogenicity of the germ. And if it produces neurotoxins, if it suppresses the glands, the inner organs or not, this is determined by the inner milieu, whatever inner milieu is determined by. Our individualized program, which lasts 3 weeks for the beginning, 6 weeks for the intensive part, and afterwards it's a treatment of 1 to 2 years. The patients who really were very sick and very disturbed neurologically, very often also psychologically, but especially with their nerves and nerve system, they take normally 1 to even 2 or sometimes even longer years until they are really well again. But they normally get very well. 80% within several months, they get much better, back to work, back to nearly normality. It makes the patient heal from the side effect of unnecessary and hurting antibiotics. When I say so, unnecessary and hurting antibiotics, I will go a little bit deeper on this. It makes the patient less susceptible to other infections. And this is important. These patients not only suffer from Borrelia burgdorferi, from the Lyme's bacteria, they normally are also susceptible to other infections. And when we look for these infections, which are a little bit further, a little bit more difficult to determine and to find, then we see that the bad cases of Lyme's patients, they always have viral infections behind too. And not only viral infections, they also have toxic loads behind too. So it's a toxic, viral and a little bit bacterial disease, which they come. And they get treated with antibiotics, especially phase 2 and 3, Rocephin, for example, which even contains toxins, preservatives and mercury. Because some of the intravenous antibiotics, they are bound and they are fixed to thiomersal, which is a mercury-containing substance. And therefore, it even changes, as we will see, the bacteria to more pathogenicity and more neurotoxic behavior. Therefore, we try to drain, whatever draining means, we try to eliminate these toxic loads, not only from the nutrition, from the life before, but also from the treatment which they have. And very often I see that these patients who come with the severe neurological problems, having Lyme's, they are toxic problems. And the typical neurotoxic effect of the antibiotics long term make them so diseased. It brings back the patient to work. Most of my patients, they were back to work. Now this is a little bit enlarged presentation of the tick. The tick is a spider. It's not an insect. Well, it's an insect, but it's a spider. It has 8 legs. And it bites, as you know. And the spider sucks blood, has a reservoir of blood, and sucking again and biting again. This blood, which is in the reservoir of the blood reservoir of it's like a nutrition bag for the tick. When another bite comes, then the blood can go into the blood of the second tick, bitten individual, which then can be a human. The carrier, the reservoir, don't get sick, which are the deers, squirrel, deers, and foxes, but especially deer are the reservoir of these insects. Now, let us look a little bit behind. The thinking is nowadays, and this thinking is produced by the antibiotic industry because they found a new good business to have antibiotics given to these patients, and therefore the thinking of Borrelia burgdorferi makes Lyme disease. We have to think a little bit behind this reflex, which is not true. 1/3 of the ticks are Borrelia is the germ, Borrelia carriers. 1/10 to 1/20 of the tick bites lead to a borreliosis disease. So it's only 1 to 3 up to 1 to 6 that if you have an infection of Borrelia, then you get the disease. Number 1, well, that's stage 1. The stage 1, which is in most cases harmless. And many patients don't even realize that they have stage 1. We will come to the symptoms later. 1/30 of the borreliosis stage 1 comes to stage 2 if not treated. So, again, we have to ask, why do 29 patients of having stage 1 not get stage 2? What is there behind? Is it the immune system, or is it the pathogenicity, or the aggressivity of the germ, or what is it? So, this is a very important question. Couldn't we make something so that the 30th of these patients also doesn't get stage 2? It can't be only the Borrelia burgdorferi bacteria. It can't be, because otherwise everybody would get it. Now, from stage 2 to stage 3, here it's even more. Therefore, the real stage 3 borreliosis is not so frequent. Now I know that the numbers, they increased, of course. It's, as Lisa said already, the fastest increasing disease in in the United States, in North America. The fastest increasing disease. The fastest increasing autoimmune disease is Hashimoto's thyroiditis. So we always say cancer is so much increasing in number. That's true. But there are other autoimmune diseases which even are much more a problem. And all these autoimmune diseases and these infectious diseases, they begin to be a real social problem, because there are so many young people who get out of work by these kind of diseases. And it's not the bacteria, I tell you in one word, it's the toxicity. And it's viral backgrounds, which is really behind. As also in autoimmune diseases. It's not the bacteria, but the milieu, the inner milieu, which makes you resistant or not resistant to this bacteria. Lyme's disease is a toxic disease. Lyme's disease, I will show you numbers afterwards that it is a toxic disease. Numbers parallel to toxic load in water, especially mercury. Just in this area, a very interesting research study was done over several years. Lyme's disease is caused by spirochetes. Spirochetes are bacteria which are very normal in human being. We have spirochetes in our mouth, which is a normal germ which is normally present. Our body is even used to live with spirochetes. That's not primarily a disease, it's just a presence. But there are spirochetes which can change the behavior, which can change the pathogenicity in relation to what the patient has as inner milieu. What is the inner milieu? The milieu is determined by acid base, is determined by toxic load, is determined by how much protein you have in your body. And there is a disease which was in our grandparents, great-grandparents of biggest importance, which was also a spirochete disease. It was syphilis. Is this the name for this sexual disease, syphilis? It was more or less exactly the same germ as we have now on borreliosis. More or less exactly the same germ. And it made a different appearance, but it also had stage 1 skin, also stage 2 joints, also stage 3 brain symptoms. As Borrelia begins with the rash on the skin, second stage goes to the joints and makes arthritis. About 40% of the non-known cause arthritis in Switzerland are Borrelia arthritis, stage 2. And then they find it because they look, a patient comes with rheumatoid arthritis, which is not really rheumatoid arthritis, and they do the tests and they find the Borrelia antibodies, and then they find the cause. But it is not the cause. These patients are toxic laden. Well, syphilis disappeared in a way, even though the average population hasn't changed much in the sexual behavior. Even more would be the chance that we could have. Why did this disease disappear and doesn't have the importance anymore as it had? Because even though the germ is around still, there must be a different inner milieu, a different acceptance to this germ spirochetes. I do 1 minute. I go to a totally different item, totally different. You know, even each speech should have a little pause, and we make this pause now. There are numbers on the inner milieu of the average population. In 1950, Germany, Switzerland, and I think around 1950, it was the governments, they began to do numbers on the intake of patients, the food intake. And they determined, I take the numbers of Germany, but the numbers of Switzerland is more or less the same, and I'm sure that the numbers here are the same or even worse. Our grandfathers in 1950, they had the protein intake of definition 100%. It was about 45 grams per day, protein intake. And this was determined 100%. And then they began, every year they make analyses. And they are now, our population has an intake now of 320%. 3.2 times more than our grandfathers had protein intake. Minerals and trace elements. Also, definition 100%. Of course, it's difficult to define, but there are good statistics. 100% definition, 1950. Do you know how much today? And this number comes from the United States, 22. We have 1/5 of the intake of trace elements and minerals, and 3 times the intake of protein. Protein congests in an overload the lymph, and the lymphatic cells, our lymph cells, they are the antiviral, antibacterial cells, and they get stuck in this protein glue in our interstitial space, because we can't process so much protein. It's absolutely impossible. You can't process this amount of protein which you put into yourself. And this lowers the immune system. That's why we have new viruses. That's why we have many bacterial diseases which haven't been. And we have less minerals. Zinc, for example. Selenium, which is absolutely needed for all activity antibacterial. So we don't have our inner antibiotics anymore. And that's why germs in this totally different milieu, they begin to develop differently. Some, they no more survive, like the syphilis or like the tuberculosis. We don't have these tuberculosis epidemics anymore in the Western world because our milieu changed and doesn't fit to them anymore. But we have the new germs, the viruses and the new bacteria, which are very well liking our horrible inner milieu. And if we change this inner milieu, they can't survive and they will behave differently. Therefore, we just have to take away the milieu which they like. And that's Paracelsus medicine. That's our way of approach. We just change your milieu, we detoxify, we change the diet, we look what you are good, what you can process and what you can't process, and we give exactly this amount of protein which you can process and not more, because more would glue into your lymphatic system, and the Borrelia, they would like this very much. Yes, that's not. Now we get back to my speech. So we have a new syphilis in our world. It's not sexually transmitted. It's tick transmitted. Has nothing to do with sexuality, but it's the same germ in a different milieu, but it behaves very, very similar. And it was always clear that the epidemics on syphilis, the epidemics which we had post-war of tuberculosis, was not to bring under control with antibiotics. Not at all. Only the milieu change of the average population made that these epidemics, they just disappeared. Antibiotics make the cause of the disease worse. And antibiotics, that's not my idea, not at all. Scientific studies. I don't give indices here on which papers it was published. But just believe me, under antibiotics, the germ borreliosis changes to a so-called cell wall deficient bacteria and can penetrate into into tissues, can make a so-called cyst building forms, and infiltrate tissue with a low metabolism. For the medical people in here, bradytropic tissues like tendons, like connective tissue, but also nerve tissue, they just hang in there and they stay there. And they wait until the milieu gets even worse, and then they can switch to more activity. There is a study which was done here in this area several years ago. The borreliosis 2 and 3 numbers go parallel with the heavy metal water concentration. They just looked, these poor ticks, in what kind of environment are they? And could it have any relation on what they are in, the ticks, you know, and the deer, what they are in, and does this determine the pathogenicity of the germ? Does it change something? And, well, in this study, it was also shown Lisa was right when she said even a much higher number. It depends how you count. These countings were stage 2 borreliosis under medical treatment. This was the index how they found. And you see within 10 years it was nearly 10 times more frequent. Extremely fast increasing. When we look at the borreliosis carrier, the carrier which we can see with the antibody testing, when we look at this, then we see that more or less 40% of the normal population has dealt with ticks, with Borrelia, and has positive antibodies. So, when you go to the train station or to the airport and you just collect all the patients, all the people there, and you test them for borreliosis, antibody IgG and IgM, and also the flagella antibodies, you will see 40% of the average population has this disease. Well, but they don't have any symptoms. So they are carrier, or they were carrier, and they have dealt with the disease themselves. Therefore, again, another proof which shows that it is not the diagnosis from the blood. Somebody comes to the doctor, has severe symptoms, can't concentrate, can't look anymore, can't collect the thinking, the typical Borrelia, what is said that it's the typical Borrelia symptom, that these neurological symptoms, nobody knows what it is. We do antibody testing. Borreliosis, we have to treat with antibodies. But if you would, in the same practice of the same doctors, if you would collect everybody and you would test them we would see 40% of the people have the same findings in serology. So the serological finding is not showing if you really have Borrelia. If you once had it, it will be there. And when you treat it with antibiotics, you will have the cyst form where you never will get away from this typical serological blood test finding, even when you are healthy. That's why our patients, they just get better, but the test will still show positive, because the test showing positive doesn't say that they have the symptoms. That's two different things. Well, now we look. You know this map much better than I do. here is the little town. Well, I have never been there. I don't know if. How big is Lyme? Small. 80,000 inhabitants. No, of course not. Well, I don't know this town. It was just found, and this gave the name to this world-known disease now. Lyme, a little town. Why here? Okay, and here, look there, Marion. Marion, which is so close to this town. And Marion, which means so much to me, because it was my entrance into the United States and into the medical world of the United States. And again, Margie and Michael, many thanks. Next. There are other towns. Well, this is for, you know, when I show this in Europe, nobody knows where is Marion. and here is Portland, Maine, here is Providence, here is Boston, here is New York, Philadelphia. Now comes the interesting thing. They looked how many diseased patients. Blue is how many diseased patients. And the maximum is in our area. Now it would be even higher numbers. Providence, Boston, there they had very high numbers of diseased patients per so and so many, per 100,000 inhabitants. Then they looked in the same areas. They looked how is the environmental situation, and they found toxicity, heavy metal in water in percent, and it was just made, well, fixed percent. Philadelphia, it goes up and goes down to Portland. In the area where we are now, there is more toxicity, well, still low numbers, but it is dependent. The number of diseases is parallel with the toxicity of the water. So these poor ticks, they get poisoned by the water they are in, and their animals, the deer. The bad part is only that we also get poisoned. And this poisonous inner milieu, which we not even can do much against without treatment, makes the germ feel well in ourselves. And this is the interesting correlation, which is, it's interesting. The germ was cultivated by a Dr. Willy Burgdorfer, which of course was a Swiss guy. And that's why it's Borrelia burgdorferi, which means detected by him. But the correlation to the disease was only found in 1983. So we have such an epidemic, such an important disease. When I studied in the 70s, this was not known. Absolutely new disease, and has such an importance today. That's why the old medical books, they are for nothing in these modern diseases. You can't see and you can't learn out of it. It's spirochetes. The depot, well, where are these bacteria? In mice and birds and deer. And the carriers, which bring it to the human being, is the tick. And I have to say this. The tick disease vaccines don't protect at all. Not the slightest bit for this Borrelia. And it's a different germ which is vaccinated. And this vaccination is a dangerous vaccination. And we do not suggest to do it. Why? You will see later. Symptoms. I don't know any other disease which has such a multiplexicity of symptoms. I don't know a single patient who has the same symptoms as another patient. So it's totally different from one to the other. Phase 1, which is harmless, it's like a flu. People get fever, they feel a little bit sick, and they have perhaps joint pains, but it doesn't make much. 3 weeks after the tick bite, that's the incubation time, a rash goes. As if you would, in a quiet water, you drop a stone, then it gives, a wave, which goes in a ring form outside. So this rash goes like this wave to the periphery and disappears. It disappears normally within, even if you do nothing, it disappears within several days, normally. And it can make some swelling. I also had patients who had general swelling. They were slim, they had thin skin, and then after this tick bite and after these 3 weeks, they get a general, the skin just blows up a bit. But you can't grab the symptoms because it's not much. Phase 2, and from phase 1 to phase 2 can be either no, it does not appear, but normally it can be several weeks to several months from phase 1 to phase 2. Therefore, these patients, they normally no more know. You have to ask, well, did you really not have a tick bite? Most patients don't know. Well, did you ever have an insect bite? Or did you have normally it's on the neck, or it's here, or it's on the legs, or here, where the ticks, they fall in. And then, did you ever have a rash which went there? Then perhaps they remember. Phase 2 makes muscle pain and makes joint pain. That's the most frequent arthritis nowadays. And it makes lymphatic swelling of the joints, but also lymphatic swelling of the legs and the arms and so on. It makes fever and very typical headache. Phase 3 is only rare. And nowadays I am convinced that the biggest part of the phase 3 borreliosis is not the tick phase 3 stage, but it is toxicity from treatment. All neurological symptoms and paralyses, brain symptoms, cramps, eye problems, chronic fatigue, and most of the patients they get, some even come because of these symptoms, psychological symptoms. Depression, no more seeing over the mountain, as we say, no motivation, no more being able to collect the thinking. I had a girl here who came 2 years ago, also here, and then was treated. She could no more write because she knew how to write. She was a student, very intelligent, super intelligent, good student, but no more able to put the thinking into writing. So she didn't know anymore, how do we write this in this word? Or she no more found the words. She knew what she wanted to say, but didn't find the words. Like an 85-year-old. No, it's very, very sad. And then, afterwards, the paralysis of the muscle came. But it was also from the brain. A typical brain expression of this disease. But the main finding she had was extremely high mercury load, which is the first thing which we test when a patient comes. Mercury load, palladium load, cadmium load from smoking, but cadmium also from industry waste, and mercury also from industry waste. We have mercury in our waters, and this fills and concentrates, and there are people who do more concentration. They just have a concentration tendency in their body. They don't have the possibility to detoxify. When they come to our clinic, I do glutathione transferase, epoxide hydrolase for the doctors in here, and other enzymes I test genetically if can they do the detoxification of the heavy metals. Are they able to do it? And in our borreliosis, but also virus patients, we see more and more an increased number of patients who can't detoxify. So it's not the Borrelia, it's the toxic load, which the little bit of toxicity, neurotoxins, which the cystic forms of the Borrelia produces. When we treat them, when we make them cell wall deficient, they no more keep their toxins, their metabolic products, they no more keep inside themselves these ticks. They lose their cell walls, the cell walls get degenerated by the treatment, and then these neurotoxins, they waste to the body and attack the brain. But this attacking the brain is only possible when other things also are there. When, for example, the patient can't detoxify. Decreased liver function, decreased genetically decreased function of the detoxification. And we make the gene test out of a little bit of blood, and we see, oops, they can't detoxify. So it's a toxic problem. It's not a tick. And they are, well, we have serological tests. You can read this everywhere. We just wrote an article on borreliosis, but much more important is the heavy metal test, is the stool test, because we have one detoxifier and the best antibacterial system which is existing in the world is our intestinal flora. And they detoxify, they work like blossom paper, and they collect the toxins out of the body in our intensive, in our big intestinal mucous membranes. When they have good intestinal bacteria, they detoxify ourselves. And so the mercury comes over the bacteria into the stool and comes out. We test stool for mercury. We test stool for bacteria, for the detoxification bacteria, Lactophilus, Bifidus, Bacteroides. And these are the things. Day one, when a patient comes to us, we make the gene test, we make the heavy metal test, and we make the stool test to see how strong is the patient in detoxification, and this has to be changed. And this lasts for several weeks. Here, for example, we have a typical form of dark field. Dark field is one test which we also do, and we see this kind of cystic bacteria in the dark field. They really are there, no doubt, but they are not the only cause. Well, our paradigms and principles to detoxify. Detoxification with selenium, vitamin C, with infusions, with colonics and other means. Increase the immune system by healing the intestines. The intestinal bacteria have to be increased. We increase the upbuilding forces, nutrition and supplements, as we know how poor we are in our nutrification, in our nutrition, what we take in. It's too little of good trace elements, too little of substances which we would need to be strong in our immune system. The bacteria are not the cause, but expression of the problem. The fact that you get such bacteria, which most people aren't bothered by, shows that there is a weakness in your system. And this weakness has to be approached. Well, it's simple, very simple. Detoxification, intestinal health and bacteria, and number 3, regeneration. The nerve cells, which are by these neurotoxins, which are created by the bacteria, the neurotoxins, and added to the toxicity, the neurotoxicity of the mercury. You know, the bacteria produces organic substances, and these organic substances, they would be detoxified in the liver normally and go to the intestines and be absorbed by the intestinal bacteria and eliminated. But not so if you have a wrong intestinal flora. Not so if you have a weak liver, and this is the problem. So they bind with mercury, and they make an insoluble binding of organic and inorganic toxic complex. And this complex, it just stays in your body and can go to the nerve cells. Because these cyst forms, they go to the low metabolism tissues, which is the nerve cells, which is the tendons. That's why they get tendons pain, fibromyalgia, pain in the joints, because they like to stay in this low circulation area. And they bind their toxins with the mercury, with the palladium, with the cadmium, with the arsenic. Arsenic, very frequent, arsenic. If we would test you in here, arsenic, which is a nerve stimulator, makes nerve pains. If we would test in here, I'm sure that about 30% of these people in here would have an elevated, much too high arsenic concentration. Only this you can tolerate. But if other things come in addition, then it makes a neurotoxic disease. So we have to look, what kind of toxins do you have in yourself, and then specifically drain. These 3 circles, they fit for all the diseases. If you have seen other speeches of mine, always this and always this, the barrel of disease. So it takes a certain time until you get a disease. The barrel has to be full, and it fills up very slowly. It needs years to fill up, and then you get your disease. That's very simple, but it's in Borrelia, it's exactly the same as in all other diseases also. And when we look, the acute disease is not the problem, but what is beyond there. Toxins, heavy metals, hyperacidity, wrong nutrition, too much protein for years. And then we have other things too, which come more and more and more, which is the electromagnetic load, which also disturbs your body. If you walk around this all day long, what the young people do, they phone with their mobile phones. They have the whatever. They sit before the computer. All electromagnetic loads, which also bother the nerve system, which are brain disturbing. Electromagnetic, the power stations, but much worse is the phoning. Therefore, no more phoning with the mobile phone like this. You have a line and you take the earplug in here. Then it has about 1% of the load as it has here. Do you know which cancer is the fastest growing cancer? It's brain cancer, glioblastoma. And there is more and more evidence that it has a relation to the electromagnetic load to the brain. You see, these young people, these young patients, they phone, they computer, they have this and this and this, they have mercury, they have arsenic, they have the wrong nutrition, and then they get the Borrelia infection in addition, and then the worst, they go to the doctor and they get antibiotics. Really? This makes the load, and then it begins to get very bad. Therefore, well, you know it now. The treatment are heavy metal, fatty acid. Now comes a new chapter, the fatty acid problem. The fatty acid problem. When we look at patients with neurological diseases, we look at multiple sclerosis, we look at borreliosis stage 3, the neuroborreliosis. We look at other neurological patients, for example, the trigeminal neuralgia. We look at such kind of neurological patients, but also psychiatric patients, depression patients. And we measure the fatty acid profile. It's a cheap test. It costs about, in Switzerland, costs about $90. It's really not much. But you see exactly how are the phospholipids, how are the omega-3, the omega-6, the bad fatty acids, and we can see these patients, they have a decrease, all the neurological, not a single patient with borreliosis stage 3, not a single patient with MS, two different diseases, of course, but not a single one had normal phospholipids and good omega-3 fatty acids. Therefore, the resistance, the quality of the nerve protecting substances of the nerve itself, they were so weak, these nerve cells, and so attackable by a bacteria, by a toxin, because they don't have their protecting seal around, which is the phospholipids, which is the omega-3 fatty acids, especially the DHA. They have a decreased amount. Therefore, they can't, even if they would be disturbed, even if the nerves are diseased, they can't rebuild. And to be able to rebuild, to get the strength again in their nerve cells, they have to have these substances. Manganese, molybdenum, zinc, phospholipids, phosphatidylcholine. You can get it so cheap here, phosphatidylserine and phosphatidylcholine. And these poor Borrelia patients, the Lyme patients, they have on the floor really deep concentration, and they need it even intravenously. So they need this instead of the crazy antibiotics. Hyperacidity and hyperproteinization, well, we look what the patient should eat and what not. These are the three most frequent causes for all, especially all neurological and psychiatric diseases or problems, but also for Lyme's 3. Well, the heavy metal I spoke about already. Daily and weekly we make detox infusions. The patient has to come 3 to 6 weeks to our clinic. It's worth. And we do every day in the beginning the detoxification infusion. This is detoxifying, shuffling the bad thing away, and increased nutrition with infusion of phosphatidylcholine, phosphatidylserine, of omega-3 fatty acids, and all these substances we supply so that the rebuilding goes quicker. Alpha-lipoic acid, I forgot, it's also very important. Vitamin C, 1 gram. And then algae. The algae are important because they replace the function of the blossom paper in our intestines, the intestinal bacteria which bind the toxins. And as we don't have enough of these bacteria because of the poor nutrition and the hyperproteinization, people still think that meat is good, and so they get wrong bacteria which no more detoxify, and that's why we have to give algae. That's what we do. And alpha-lipoic acid. Heavy metals and other toxins allow wrong and pathogenic bacteria to grow, one side, and also to produce their toxicity. Ozone, unfortunately, not allowed in the United States, even though it is one of the best treatments. Ozone therapy is the strongest metabolic activator, and if we want to have more resistance, we give this. Well, look, now comes something very important. Our really bad patients. For example, the girl whom I just told you about, who was more or less paralyzed, no more could think, no more could write, even had problems with speaking. This was only one example, but we have this very often. Well, I would say all. They also have neurotropic viruses. Neurotropic viruses are viruses which can make the same thing, the same phenomena. And we have these meningoencephalitis, which comes from the unnecessary and very dangerous tick vaccination. Herpes, shingle virus, and herpes simplex. Chlamydia is very frequent. Toxoplasmosis, we find in more or less all of these neurological patients, but the very most important is the cytomegalia. It's not written here because it comes later. Cytomegalia. Cytomegalia is a virus which normally doesn't make much, but can be toxic and can be nerve destroying in combination with organic toxins in the body. And organic toxins are produced by the cystic form of the Borrelia. So the combination, when we find these two things together, then the chance to really get sick is bigger. So we have developed, it's not my invention, but we have redeveloped this old-fashioned kind of treatment, a homeopathic treatment which is very, very specific against viruses. So I take the blood of the patient and we test all these viruses, IgG, IgM, and the two kind of antibiotics, just for all these viruses. I don't know if you have this or this or this virus. I just test just out of the blue. And because I know that they are quite frequent. And the ones which show positive, measles, meningoencephalitis, hepatitis, such viruses which can also attack the brain and the nerve cells, then I train the immune system very specifically to work against these viruses, the white blood cells. And these training substances, they are called nosodes, and they are very specifically for the virus. Well, that's more for the doctors. We can jump over this. And now we also have a treatment which is a little bit too much detailed for lay people, but that's what we do on our Borrelia patients. That's just the ones who have to do this on long term. It's something which builds up the intestinal flora, something which specifically antibacterially trains the immune system. Then there comes this miracle plant from Switzerland, from the Swiss Alps, which is a root of a plant which is well, unfortunately protected because it's dying out, and there is a company which tries to cultivate and does concentrated extract out of it. But there is also the possibility of garlic. Garlic has quite similar substances also, but this plant has it in a very high concentration, and it really works directly antibacterial. Then we have this, that's a nosode, and then we have the vitamin C, which we give. And the lowest is pure homeopathy. It's a little bit too much to explain. That's the treatment. The intestines are the main factor for the immune system, and we have to increase the intestinal situation on these patients. The intestinal mucous membranes are the biggest organ, and that's why it's so important to build up the intestinal system, because it's the site of our lymph cell. The lymph cell is the antiviral, antibacterial cell which activates the immune system. They produce hormones and neurotransmitters. If you have a stable neurological system, depends on histamine, depends on serotonin, and the serotonin is produced in the intestines. About 90% of the serotonin is produced in the intestines, and when you have a low intestinal function, you have less serotonin and you get more irritated, because the histamine gets higher when the serotonin is low, and then you have this hyperactivity, hyperreactivity, hypersensitivity of the brain, of the nerve functions, which normally the Borrelia patients have. Neurotransmitters are low. And it's the home of parasympathetic system and the lymph cells. Therefore, the intestinal function is the really very important part of the basic treatment. When I said it needs 2-3 years to really get healed means that your system is so healthy that not only Borrelia, but also other bacteria have no more chances. And these patients are the least susceptible for infections after several years, because they have a better system. Food allergy is the main reason for a weak intestinal system. Food allergy, and for especially against dairy and wheat. Therefore, our first several months of treatment, we don't give any food which could be allergic. We avoid the whole dairy products. If you are outside afterwards, you can see my book, which is on the nutritional part of how you could increase your immune system, the Swiss Secret book. But on the other side, we also have the preservatives, the phosphates in drinks, the sulfur in meats, the alcohol, which destroys the nerve cells. Sulfur which is quite high in meat, phosphates in drinks, which is the preservatives. In many artificial drinks like Coca-Cola, Pepsi-Cola, Fanta, and or Sprite, and all these drinks which are taken so frequently, there are these preservatives, which are the phosphates, the taste preservatives, which make dependent, which makes this specific good taste which children like so much. And when you do this for years and years and years, you get such a high phosphoric acid concentration in your tissue that it preserves there too. It's very bad. Now, last slide. You know, I like to be in the United States. I have my big idol. You say idol? Yeah. John Wayne, you know. Why is this the man? Because this guy always had to do with heavy problems, you know. All these criminals which he had to look against. And what did he do? Zack, he shot and they fell. So I need such a treatment. I have from worldwide all these heavy patients come to me, not heavy in weight, of course. The difficult cases, they come, and I would like to have a shooting, and zack, the problem is solved. So, what could I do to shoot the big problem? And to be so successful as he was, 80%, I would say. No, he must have been 100%. Otherwise, you can imagine. I shoot 3 times. I say no dairy products because it's the most frequent destroyer of the intestines. No nuts, very least important, but no wheat and sugar. If I can only shoot 2 times, I say no dairy products and no wheat products and no sugar. Because this destroys the immune system and destroys the intestines. And when you have weak intestine, you have no chance against even harmless bacteria and viruses. And by doing so, you hit 90% of all the chronic infectious problems. Well, now comes specifically, we have special things to eat and to what we suggest very much. We have this product here. It's an amino acid product, and this is more for the professionals, what we give as remedies for the intestines and also for the borreliosis. But this is less important than what is written here. The nutrition, if you want to have a good immune system, then you have to have little animal protein, much green leafy vegetables, no alcoholic drinks, and we give these things. But even more important is that you get a lot of omega-3 fatty acids, and that you get, which is in linseed oil, flaxseed oil, linseed oil, you say, linseed oil, and vermouth in form of drops, which increases the liver and the rebuilding function of the body, and little protein but good amino acids. And you can have this from leafy vegetables and from, well, such things. Anyhow, this is written in my book, which you can see outside, the Swiss Secret. It is 3 programs, the detox week, the 3 weeks cure, and the maintenance diet. With this, you can make your immune system and your detoxification much, much better. And now I have to stop, and perhaps there is some questions. I don't know if there is time for questions or not. Okay, this is what I wanted to tell you. I know it was quite fast and a lot, but I thank you very much for listening. Yes?
There are some people who believe that high doses of vitamin D are counterproductive to the destruction of the Borrelia. Now, in your program, do you believe in high doses or low doses of vitamin D levels in the body for conquering Borrelia?
If we look at the question was vitamin D and Borrelia. I think that's a very specific question and a detailed question, but still I like to answer. Now, if we look at the population, and if we would test in all of you, as long as you don't take vitamin D, but if you would test the vitamin D level, then the average would be very low, very low. And therefore, my thinking is that if a population is low in something, and if there is a disease which in this population is increasing, perhaps it could have a relation. I don't see it so specifically, but I think the average of the American population is much too low in vitamin D, and therefore I suggest to take vitamin D. But if you have my diet, which is described in my book, then you get to a normal level of vitamin D.
Is that D2 or D3?
This would be D3. D3.
I just discovered last week that I have a new strain of. I just discovered that I have a new strain of Lyme disease. I just found out about 2 weeks ago. I've been suffering with it for 3 years.
You have a what?
A new strain of Lyme disease.
I don't understand this.
New strain.
What strain is it?
What is it called?
They don't know yet.
A new kind of Lyme.
Aha, a new kind. Well, it develops all the time. You know, these new germs, they develop, new viruses come up. And so, but we have to counter with these new germs anyhow. And it doesn't matter so much. What is important is that you have a good immune system. And that's what you have to work on it. I think we have only a little bit more time. Yes?
Do you have had any success reversing people with multiple chemical sensitivity? You've had some Lyme for many years.
I repeat the question. Yeah. The lady asked, do we have success with multiple chemical sensitivity? The answer is clearly yes. But if you would ask, how do you treat them? Again, I could just change the word. Because it's the same thing. It's also a load of toxic which one day gets so increased, so much that you just destroy the nerve or dysfunction the nerve cells. And again, it's helping the nerve cells to recover with the oils and phospholipids and the fats and so on, and the diet which makes the immune system better, and the detoxification. There, they need the multiple chemical sensitivity. They have a lot of organic toxins, and they need a liver treatment, mainly a liver detoxification treatment. But it takes even longer than in Borrelia. They really take long. Long means 2-3 years. But after 6 weeks, they begin to feel that it gets better.
The treatment in your book for the liver detox, would that be effective in detoxing heavy metals?
Yes, the question is the liver detox, which I described in my book. You know, it's not for everybody. If, for example, a patient comes with a multiple chemical sensitivity, or this girl comes with the severe borreliosis, then we can't make just out of the beginning this liver detox, because it's too intense, and it would release too much and wash out too much toxins. Then you have to be very careful and begin slowly. Liver detox, which is described, is quite an intense detoxification. One more question. She was first.
I know you say no dairy. Do you feel the same about kefir if you make it yourself with organic milk from cows that are grass-fed?
Well, that's a good question. She asks, what about kefir? Kefir, which is also made out of milk. Well, the lactic acid-rich milk products, they are better. If you would make at home from an organic milk, really happy cows, no chemical treatments, and such milk, where do you have them from? But still, then you would make your own yogurt and would make it so acid, so lactic acid rich, then it would be okay. But all in all, I must say, avoid, at least in the beginning, several months, avoid dairy products, because it's the most frequent food allergen. But you could take goat and sheep yogurt. Really last question.
What if you have been suffering it for quite a few years, and you've had several rounds of antibiotics, and you're starting to see cysts that are forming in your body, and now you're talking to surgeons that want to do surgery on you that are developing in your intestines? What do you do?
Perhaps this is such a specific question I would rather like to answer privately, because, you know, the combination of the two things, it's a little bit too specific for everybody here. I hope you understand it, but please come afterwards. Okay, then you are the last question.
Okay, I wanted to ask if you treat a lot of children, if they come to Switzerland, or what options you would.
In Switzerland, we have quite a lot of children. The colleague, one friend and colleague of mine who is partner since 18 years with me, he is pediatrician and he treats a lot of children, also toxic children, ADD children, hyperactivity children and so on, who are always a toxic background and a viral background. But from the United States, they don't come to us. We had few children, but not many, because it's just too much for the family, and so they come. We normally have adult patients. In my patients, it's about 1/4 of my patients are US American patients, but they are adults. Okay, I think we have to close down because we have to leave. Thank you very much.